And so this was a project that we started a few months ago with funding from ARPA-H, which is this new health agency. Um, and it's designed to look at individualized pharmacology. So what we're trying to do is use our mass spectrometry to measure all the environmental chemicals people are exposed to, all their endogenous biology, and then all the drugs and drug metabolites that are in them,
Hmm.
to see if we can start looking at how these sorts of interactions of the environmental factors, the dietary factors, and the drugs they're taking, how those interactions are occurring. I think this is a place where, like, you've probably seen like a warning label where you shouldn't drink grapefruit juice on certain when you're taking certain medications.
Yes.
That's because these furans in the grapefruit juice inhibit one of the cytochrome P450s, and so then you don't metabolize the drugs correctly.
Hmm.
And like I tell people is that it's not just grapefruit juice. There's
Yeah.
so many other things in our environment that activate or inhibit different enzymes that process
Yeah.
medications. And so when we think like, why doesn't someone respond well to a medication? It might be one of these environmental exposures that's interfering with that. And so, but we historically, we haven't systematically studied all these things at once. But these new mass spectrometry techniques let us do that. And so that's exactly what we're trying to do is scale up so we can measure as many of these environmental factors and the drugs and the drug metabolites at the same time and look at the disease outcomes and progression to see if we're seeing, explaining why some people don't respond as well to a drug.
Yeah. And when we think about chemical exposures and exogenous chemicals, it's easy to bucket things in your mind in terms of like natural versus synthetic, but it's actually not that simple. A lot of people just think, okay, synthetic bad, natural good, but you've actually mentioned several examples over a conversation of sort of all four quadrants here, where you've got natural, synthetic, good, and bad. Like you said, grapefruit and many other natural foods have compounds that are totally natural and organic that affect liver metabolism in different ways, sometimes for good, sometimes for bad. There are, you mentioned pesticides. When we think of pesticides, we think of synthetic man-made pesticides, but, caffeine and nicotine are essentially natural pesticides that you actually mentioned can have beneficial effects with respect to Parkinson's. So is there anything worth unpacking there for people in terms of good, bad, natural, synthetic, and all
Yeah,
that?
I mean, I think it is something where the source of it is something that's very critical is that um, if you have an infection, taking a synthetic antibiotic is a good thing because it
Mhm.
helps fix that condition. And we know that there's a lot of natural things that have that. So you have those different quadrants. And I think it's really about how you balance out those various exposures and again, minimize your exposure to the things that we know are bad. Like that's what it really comes down to is how to have that balance there. I think that trying to think of some other examples here of these things is that uh, we have a lot of the different things and we've talked about these different examples of I tend to think not so much about the synthetic versus natural just because I think about all the venoms and toxins that nature
Right,
makes
right.
can be very bad. And the idea that many of the chemicals that we've produced have these very strong benefits. And so when we think about things like DDT, like there, Silent Spring, and like we needed to ban all these compounds. But if you're in a place where malaria is endemic, the malaria is the greater threat, and so it's about balancing what things we actually need. And so if you have again, if you have West Nile virus that's killing people, you might be able to handle some pesticide exposure to get rid of that. But if you don't have that, you shouldn't be using those toxic compounds. And so it's like you're trying to get this overall holistic risk assessment there. And I think that's where we tend to overuse many things that we shouldn't be overusing. So the
Mhm.
idea is like, you want to be using interventions to control the problem and the minimal amount you need to do that.